What are the risks associated with a late development of fetal pole?
Hello, and welcome to our discussion on a very important topic related to pregnancy, the risks associated with a late development of the fetal pole. This topic is often a concern for expectant mothers and their healthcare providers.
What is a fetal pole?
The fetal pole is the first visible sign of a developing embryo. This tiny structure can be seen on an ultrasound scan typically around the 6th week of pregnancy. If the fetal pole develops late or is not visible at a time when it should typically be seen, this could indicate potential complications.
What does a late development of fetal pole indicate?
A late development of the fetal pole could indicate a number of different situations. In some cases, it may simply be a matter of incorrect dating. The pregnancy may not be as far along as initially thought. However, a late development could also indicate potential issues such as 1. Miscarriage. The late development of a fetal pole could be a sign of a miscarriage, especially if accompanied by other signs such as the absence of a heartbeat. 2. Blighted ovum. This is a situation where a fertilized egg attaches itself to the uterine wall, but the embryo does not develop. Symptoms might include vaginal spotting or bleeding, but some women experience no signs. 3. Ectopic pregnancy. This is when the egg implants outside the uterus, usually in the fallopian tube. A late or absent fetal pole could be a sign of an ectopic pregnancy.
What are the risks associated with late fetal pole development?
The main risks associated with a late development of the fetal pole revolve around the potential for pregnancy loss. There's also the risk of a mother having to undergo surgery in the case of an ectopic pregnancy. Emotional and psychological distress are other potential risks to consider.
How are these situations managed?
If the fetal pole is developing late, the healthcare provider will typically recommend a series of ultrasounds to monitor progress. If there is no progress seen, or if there are signs of complications like those mentioned above, specific interventions may be necessary. These can range from medication to surgical procedures, depending on the specific circumstances. The late development of a fetal pole can be a concerning sign, but it's important to remember that it doesn't necessarily mean a loss of pregnancy. With careful monitoring and appropriate medical care, many potential problems can be addressed. Always consult your healthcare provider if you have any concerns about your pregnancy. Thanks for joining us on this discussion, and we hope it has been enlightening.